Very much, Frank. Welcome.
Cabinet Secretary, Governor, Ambassador, leadership of NCI, the board and the executive committee, all protocol observed, good afternoon. 3 minutes is not much, but let's focus on what counts. What counts is impact. We all know the burden of cancer, but we need to create impact. And I want us to focus in these 3 minutes on what is possible. With the support of the counties, the County First Lady Association, the African Cancer Foundation, the International Cancer Institute, and other partners, we were able to have 17 cancer screening clinics across Kenya in the last 2 years, screening more than 25,000 women. That's possible if we come together. It's possible to make treatment accessible. We have agreements with NHIF which allow that innovative therapies, targeted therapies are funded by NHIF without co-payment of patients. So the question we have to ask ourselves, how can we have Empower clinics in every county? How can we have every cancer treatment financed by NHIF? How can we make it possible that diagnostic is paid for by NHIF? It is not expensive to pay for innovation. It is expensive to use products which do not have any clinical trials done. It is expensive to treat a patient without having a proper diagnosis. That's where we are wasting resources. So let's bring the right partners together and focus on the possibilities to treat cancer and to make it accessible to every Kenyan so that it is not a deadly disease, that we have a room full of survivors by the time we are here for the next summit. We also need to see research is already done in Kenya. There are clinical trials, phase 1, phase 2. The FDA in the US sees data from Kenyan patients when they approve new innovative medicines. So it is possible. What we need now is to say, how can we get PBB to be faster in also using this data to approve the medicine, and how can we then find the right agreement with NHIF to finance it? I think it's not only Roche, there are many partners who are willing to do this, so let's come together at summits like this to create impact, to make the right agreements together, and then fight cancer together, because none of us alone is in a position to do that. So thank you so much for being here. Thank you for all your support, and thank you for your commitment to make an impact to every cancer patient in Kenya. Thank you so much.
Thank you very much, Frank. Thank you. I'd now like to invite Anthony Gitao, Johnson & Johnson. Anthony Gitao, you have 3 minutes.
Thank you, Dr. Nginji. And I'll follow Frank's direction on being focused in the 3 minutes. I really want to echo what he has said. Madam CS, really nice to see you, and thank you for your support in this. Your Excellency, Governors, Your Excellency, the Ambassador of the US. On behalf of Johnson & Johnson, first I'd like to give our commitment that the company, as the largest healthcare organization globally, is committed to really working with everyone to ensure that we are back the gains that cancer has made. And for us, we focus on innovation. As Frank has mentioned, it's really about trying to understand and identify what are those innovations needed to ensure that when a patient is diagnosed, they're able to get exactly what they need for their care. But I'll go beyond that and really speak to the issues that we have here in Kenya about access to care. When we started this engagement in 2018, and we had an engagement with Dr. Chite, Professor Abinia at that time, the key thing that they highlighted is that we really have a shortage of healthcare professionals trained in oncology. And as the J&J Foundation, the one thing that we focus on is frontline health workers. And so our focus was on how do we support the healthcare system by bringing more healthcare workers to oncology. And we did that in partnership with AMREF to target the training of oncology nurses. At that time, we only had 36. And now, I'm pleased to say, since 2018, we've trained 254 through our colleges here. We were able to prepare with all the schools a national curriculum that was launched and endorsed by the Nursing Council. And we now have, instead of just one school that is offering oncology nursing, we now have 5. And so for us, we really see that this is a way that we can continue to increase the number of trained professionals in the field. The next phase for me is how do we then utilize these trained resources? And my challenge to you, Your Excellency, is to go back to your colleagues and say, we do have these trained professionals now, can we have them deployed in the counties so that they can provide the care where it's needed most? But more importantly, every day we talk about early detection. On a panel with the chair of the Red Ribbon Society, it was sad to hear that in the US, or rather, it was great to hear in the US that any woman detected with breast cancer in stage 1 or stage 2 would survive. And I'm glad to really see all the survivors here. How can we get to that point where we are detecting them early? And this year, Madam CS, Johnson & Johnson Foundation will be partnering with AMREF and the Aga Khan University to try and see how we can create a sustainable screening program, not just for cancer, but across NCDs, linked to the primary care networks that your ministry has developed, so that we create a sustainable way that our people get screened and identified and linked to care early enough so that the treatment outcomes are positive. I'm really happy to see you. I wish this summit all the best, and congratulations to the NCI for all this. So thank you very much.
Thank you, Anthony. And I'll send you to Mr. Anders to hand over the mic, and then Mr. Anders, UNFPA country rep, your remarks now. Thank you very much.
Excellency, Madam CS, esteemed governors, board members of the NCI, Ambassador, viewers, Whitman, ladies and gentlemen, it's really a pleasure to be here today. You might be sitting there right now and thinking, what is UNFPA doing as a platinum sponsor of this conference? Isn't UNFPA the agency that works on sexual reproductive health, bringing down maternal mortality? Isn't UNFPA the agency that is known for providing family planning commodities, working to combat gender-based violence, including FGM? Yes, it is. But we have also realized in UNFPA that we have a unique position where we can contribute specifically to the prevention of cancers that are related to the reproductive life cycle. I'm of course talking about cervical cancer, breast cancer, ovarian cancer, and these types of cancers. And they do kill, but there is a solution. And I want to quote someone, and guess who it is. He said, "We need to educate our people on the importance of visiting hospitals for screening of cancer, because if detected in its early stages, it can be successfully treated." These were the words of now President William Samoei Ruto at the very funeral of Governor Muthoni from Tharaka Nithi, who had this very emotive intervention earlier today. They are simple words, but very profound. So how can we make sure that we reach all of these people? I know the CS has a very ambitious plan to mobilize community health workers across the country. I think the aim is to have 90,000. If they're all educated to tell people what are the signs of breast cancer, how do you perform self-habitation to know how to go to the clinic, we can save lives. If we tell people that the human papillomavirus, which is sexually transmitted, can be prevented by later sexual debut, and tell people that we can save lives. If we make sure that girls and women before the sexual debut are also provided infantry, that teenage pregnancy is as high as 30, 50 in some counties, 15% nationally. So that is an entry point to prevent these cancers from spreading. So that is why I'm here today. We are very proud to be a co-sponsor of this. We want to now implement all of these strategies with all of you, with private sector, with the public sector, particularly with community health workers, to get the awareness out. The important thing is, as much as the cancer treatment is important, and I also have family members who have benefited from that, the important thing is that $1 invested in prevention can save you $10 in treatment. And it's not to say we don't need treatment, but I think for the economy and for the health of the population in Kenya, it is a wise strategy to adopt across the country. Thank you very much.
Thank you very much to our partners. I would now like to announce that the next summit is going to be the first week of February 2024, and I want to urge our partners to commit their support right now for 2024 February. I see smiles, so I take that as a platinum confirmation. Thank you very much. I will now ask our partners to take their seats. We thank you most sincerely for enabling this. Honorable CS, allow me to break protocol again on the program, because I had a request from Governor Anyang' Nyong'o that he has a meeting, and I think if we follow this, we might annoy him. And I have never wanted to see an annoyed Anyang' Nyong'o, actually. So I will now like to, with your permission, before everyone else, to invite Governor Anyang' Nyong'o, so that after that he's free to leave us pleasure as we continue with the rest of the opening ceremony. Governor, welcome.
I've already punished myself by falling down. Thank you very much, ladies and gentlemen. I was telling Gidinji that I've already punished myself by falling down and for leaving early, but I thank him for giving me the opportunity to go to yet another important meeting that was scheduled more or less soon after this. Fellow governors, my governor Mudoni Njuki has gone, but I'm standing here on behalf of the chairman of the Council of Governors, Madam from Governor of Kirinyaga, the CS Ministry of Health, national government officials, present development partners, representatives of private sectors, fellow conference attendants, ladies and gentlemen. I'm happy to be here today because this forum is of utmost importance to Kenyan citizens, county government, and all of us. As such, on behalf of the Council of Governors and county governments, let me take this early opportunity to appreciate all of you for both attending this important meeting, as well as being the forefront of the fight against cancer in Kenya. I think Gidinji has made it very clear in his presentation on the status of cancer treatment, prevention, and care in our nation. I also thank the two gentlemen from the private sector, particularly Frank Loeffler of Roche, for the very candid discussion has ignited among us to stop just talking and go to action. Over the past decade, county governments have worked closely with various stakeholders, including the national government, to ensure that all Kenyans have access to high quality and affordable preventive, curative, rehabilitative, and palliative health services in our nation. And as we saw 2 weeks ago when the Kenya National Bureau of Statistics released the 2022 Demographic and Health Service Key Indicators report, Kenya has made significant health gains in the past 10 years of devolution. And that is something we should appreciate. This has been achieved through progressive investments across all important pillars of the health system, although there are still tremendous gaps to cover. As we begin this forum here today, I would like to affirm that county governments continue to be fully committed to ensure that all Kenyan citizens have access to the full range of quality health services that they need, when and where they need them, and without suffering any financial hardships. And this includes cancer. I say this with the assumption that the necessary resources will always be available to county governments to meet our objectives in the health space. We know that cancer is one of the leading causes of death, both globally and here in Kenya, exerting tremendous physical, emotional, and financial strain on individuals, families, communities, and health systems. Currently, 2 out of every 3 persons diagnosed with cancer will die out of the disease, since 70% of cases are diagnosed in advanced stages. We have to change this reality, and we need to do it now. This summit, ladies and gentlemen, provides a golden opportunity for us to join hands and reflect, learn, reimagine, and redesign our cancer interventions. We need to listen to one another, ask ourselves what has worked and what has not worked, and use these insights to inform the path forward. Having said that, ladies and gentlemen, let me mention a few important areas from a county perspective that as a country we need to focus on. First and foremost, let me talk about cancer prevention. Our policies, strategy, and actions around cancer have relative gaps when it comes to primary prevention of cancer. For instance, one may want to ask if our public health programs have the necessary tools and capacity to effectively identify, manage, and eliminate cancer risk factors at home, in food, within communities, at workplaces, in schools, and in other public places. The recent discussion, ladies and gentlemen, on whether certain forms of food should be allowed in our nation or not must be based on fact, research, and not fiction. And in that regard, we should listen to voices not just nationally, but internationally, which have thrown knowledge into the public domain about what kinds of food, what kind of nutrition we need to have to prevent cancer. One may also want to ask if our communities are empowered enough for cancer prevention, and if the environment they live in allows them to live lives safe of cancer-causing agents. I'll let you answer those questions yourself. But I know one of the reasons why cancer may not have been prevalent earlier in this nation, pre- and post-independence, is because of the prevalent use of organic food in rural communities, something that has subsided to use of processed foods and foods that are not very useful for the nutrition in human beings. Today, I don't want to talk about why prevention makes sense to individuals, families, communities, and governments. You already know that. I also don't want to talk about the fact that preventive health remains a missed opportunity in our health system at national, county, and individual levels. You already know that as well. But what I want to highlight is that there's a major role for all of us in placing preventive health as a central pillar to our health services. I am happy that this forum has invited a wide range of stakeholders that can significantly contribute to the prevention debate. The Council of Governors remains committed to scaling up the role of preventive health in our system. And that is why some of us in the Council of Governors support the First Lady's initiative, led by my wife, the First Lady of Kisumu, regarding cervical cancer. And such, I thank those people in the health space who have supported the First Ladies in this initiative. As such, we expect this forum to adequately discuss cancer prevention and allow practical recommendations in mind for the various sectors. Secondly, let's talk about treatment and care. We all know that early cancer diagnosis is a critical factor in treatment outcome. As such, we need to strengthen and expand our cancer screening programs and reduce missed opportunities to diagnose cancer when patients present the health facilities rather late. As such, we need to continue investing to ensure that everyone who gets cancer is identified at the earliest opportunity and treated at the earliest possibility. It is known that discovered early, cancer is treated like any other disease. I never hear somebody talk about you're a malaria survivor. But we talk about cancer survivors. Anyway, it is also important for me to say at this point that county governments have made significant investment in cancer treatment. Mombasa, Nakuru, and Garissa counties are, for instance, state-of-the-art cancer centers that are able to provide referral services for neighboring counties. We shall follow on that trail. But do remember that a book recently written not too long ago by Professor Nairobi of Harvard University. The book was entitled The Emperor of All Maladies. Cancer, the Emperor of All Maladies. It is a must read for anybody trying to know something about cancer and trying to know why. Although science is very advanced, we have never had a treatment for cancer. Not that the knowledge is not there, but read Mukhalid. Then we shall know why this knowledge has not been applied to the practical problems of getting a treatment. But I must thank Kenyatta University Teaching and Referral Hospital. That was the initiative of my friend, Professor Moganda and her team, for what they are doing on the state-of-the-art institution that we now have in our nation, for both diagnosis, treatment and care, and palliative care as well, in the count for cancer. It's never too late. It is never too late to expand our knowledge on how to diagnose, treat, and care for cancer. It's only that our knowledge at the moment is limited. But Kenyatta University Teaching Referral and Research Hospital has taken the initiative to pioneer in this space. Kenya recently launched the Kenya Palliative Care Policy. Despite making rapid and significant progress in healthcare delivery since the onset of devolution, we still have a huge gap in the provision of access to palliative care across the counties. The majority of those diagnosed with cancer, 7 out of 10, are diagnosed during the late stages of this disease and will need palliative care. Very few of these patients will, however, access this care, and this access becomes more limited among certain groups, particularly children and people living with a disability. I must ask the National Health Insurance Fund. By the way, when I was Minister for Medical Services, I found that institution called the National Hospital Insurance Fund, which was a very morbid way of approaching healthcare insurance. So I insisted it must be called the National Health Insurance Fund, and applied with the help of somebody smiling in front of me. That was done. Less than 5% of pediatric patients who need palliative care have access to it. This simply means that many of our patients are not just dying, they are dying painfully. This is a trend we all must change. We know that many times cancer comes alongside physical, psychological, and financial burdens that often leave families in poverty. The majority of families never recover from these shocks. As such, a cancer program is not complete unless it provides quality and affordable services at a cost citizens can afford. And by the way, National Health Insurance Fund aimed at providing universal health care. The word universal must be meaningful. It cannot be universal for those of us who are in a higher income group, and non-universal for those who can afford it. So let us rethink and relook and recalculate, as it were, our meaning of universal care in Kenya. We are all aware that devolution has a fundamentally restructured health financing arrangements in Kenya, including making county government the main purchasers of primary health care services, which are most often delivered at public health facilities. With this in mind, the Council of Governors continues to engage, work, and support, and positively critique the National Health Insurance Fund to ensure it effectively plays its role as a strategic purchaser of health services. Today, most Kenyans, 3 in every 4, do not have health insurance. It is therefore my hope that this summit will provide some practical insights on getting more Kenyans on health insurance, so that UHC becomes meaningful in every home state. And finally, ladies and gentlemen, the Council of Governors encourages continued involvement and partnership with the national government, development partners, private sector actors, and other stakeholders in order to achieve universal health care. Madam CS, we shall not tire to come to these meetings and to be with you and my friend there too, with whom I work in the ministry, to realize that our dream for universal health care is realized in our lifetime. County governments remain fully committed to fulfilling the requirements provided by the Constitution of Kenya that guarantee all citizens the right to affordable and accessible quality health care. Remember the preamble to our Constitution, 2010, let alone Article 43, which is often quoted, but the preamble says that we come together as a nation under the banner, equality, liberty, and freedom. Let equality be as important as liberty and freedom. We have what it takes to positively transform the lives of our people. Let us all be selfless and give our best to our motherland as we sing, justice be our shield and defender. Let that shield be the shield of good health care for all Kenyans. I thank you.
Thank you so much, Governor. Many of us who come from Central Province know that many of us are Jiga survivors. But I do recognize the difference you're trying to make, and I appreciate that. So I would like to hand over, because you're representing the Council of Governors, I would like to hand over the report on the state of cancer, which actually reflects on about 27 counties, and this could be taken to the Marifa Center at the Council of Governors, and therefore I want you to deliver it there on behalf of Governor Amrigo. Thank you. Honorable Cabinet Secretary, we are almost coming to an end, but I would like to now request the Excellency Ambassador Margaret Whitman, U.S. Ambassador to Kenya, to come and make short remarks, and I'll hand over to PS Engineer Toom to make his remarks and then invite you. As Ambassador Margaret Whitman comes to address us, I would just like to pass our appreciation to the U.S. National Cancer Institute, with which the National Cancer Institute has been working very, very closely, including the editing of the report that we just talked about, through our Ann Chow, who works with the U.S. National Cancer Institute. Thank you very much, Ambassador. Your chance now. Thank you very much.
Thank you. Ministry of Health Cabinet Secretary, Chair of the National Cancer Institute of Kenya, Chair of the Council of Governors, and all governors, representatives from the development partners, private companies, distinguished guests, and friends, all protocol observed. It is my pleasure to be here with you for Kenya's inaugural National Cancer Summit. And by the way, congratulations on the issuance of the State of Cancer in Kenya report. You know, when I served as the CEO of Hewlett-Packard, which is a very large American technology company, we employed more than 325,000 people. And in many ways, this was my first time serving as a quasi-public health official. And you might say, why was that? It was because I saw firsthand how the company's policies and insurance choices directly affected the health of employees and all of their families. In addition, my husband is a neurosurgeon who has specialized in malignant brain tumors and their treatment. Malignant brain tumors is brain cancer, and has specialized in that treatment for over 30 years. And today he is helping train the next generation of neurosurgeons right here in Kenya. But through these experiences, I have come to have the utmost respect and admiration and empathy for the public health officials and the healthcare providers and healthcare researchers who are responsible for the healthcare outcomes of millions of people. They are the true heroes, and I'd like to recognize each and every one of you who is a healthcare provider, a healthcare researcher, or a public health official. So thank you for what you do. Unfortunately, just like in the United States, there is a great disparity among health outcomes around the world. The U.S. government appreciates that limited access to quality health care creates a negative ripple effect throughout a country's socioeconomic fabric. Families endure immeasurable grief and stress caring for and mourning for sick loved ones. Household livelihoods can be quickly overwhelmed by medical bills, leaving school fees unpaid and children unfed. At the same time, governments struggle with the impossible choice between allocating resources to invest in the future on preventative care versus care for the sick today. For all these reasons, the United States is proud to be the largest contributor to Kenya's health sector. Our annual investment of more than $600 million comprises the single largest component of Mission Nairobi's budget. Specifically for HIV, the U.S. government's $8 billion investment to support Kenya's fight against HIV/AIDS over the past 20 years is the largest bilateral investment to combat a single disease in history. And it has put Kenya on track to achieve HIV epidemic control by 2030. This shows what you can do with focus, resources, and collaboration. The positive impact of our collective health efforts is tangible and definitive. More than 1 million Kenyans currently receive U.S. government-funded life-saving HIV treatments, and since 2000, the mortality rate of Kenyan children under age 5 has dropped an estimated 56%, and overall life expectancy has increased by more than 15 years. It's a remarkable achievement of all of us in this room. With that success in mind, we are similarly proud of our investment in and partnership with the National Cancer Institution of Kenya. We are working together to reduce Kenya's cancer mortality rate, improve cancer identification and treatment, and in the process, train a new generation of clinicians and researchers. The U.S. National Cancer Institute and its funded researchers have worked with Kenyan scientists to conduct cancer research in Kenya for decades. with a focus on the questions and cancer types of greatest importance to Kenyans. And through this work together, we have significantly deepened our understanding of the cancer burden in Kenya. The U.S. National Cancer Institute is proud to have worked with and supported the Nairobi Cancer Registry at KEMRI, the Kenyan Medical Research Institute. And since its inception, in recognition of their accomplishments and the important role Kenya plays in research on cancer, designated the Nairobi Cancer Registry as a collaborating training center for sub-Saharan Africa, a huge honor. Similarly, through our joint research on the causes of esophageal cancer, Kenyan doctors at the others that improve patients' outcomes and comfort. Tenwick is also a leading neurosurgery facility in Kenya's fight against brain cancer. And the academic model providing access to healthcare program at Moi Teaching and Referral Hospital is the leading East Africa consortium to study human papillomavirus infections and cervical cancer in Kenyan women infected with HIV. You know, our joint efforts yield results that benefit not only the people of Kenya and the people of the United States, but truly the entire world. And I commend the Kenyan government for its continued investment in the NCI of Kenya and the development of Kenya's National Cancer Care Network and regional cancer treatment centers. To the NCI Kenya team, everyone here today appreciates your commitment to save lives and reduce patients' suffering. Your dedication is evident and will continue to produce great results for the people of Kenya. U.S. Embassy Nairobi remains committed to working with you. As President Biden said, to end cancer as we know it. And for the Kenyan people, we share the goal of ensuring a healthy and more prosperous Kenya. So let's continue to fight cancer together and see a brighter future for every cancer patient in Kenya. Thank you.
Thank you very much, Ambassador Hoodman. We truly appreciate the collaboration with your government and specifically with the U.S. National Cancer Institute, who have been supporting us through this entire journey, and look forward to continue to work with you, even as you plan the continued implementation of the recommendations of this summit, and looking forward to next year to look at what we'll have achieved, because we will not only look at these recommendations as a report put on the shelf, but as soon as this ends and Monday reaches, we will start looking at an implementation pathway to ensure that we save lives and give quality of life to the Kenyan people. It's now my pleasure and honor to invite Engineer Peter Toom, PS, State Department of Medical Services. Thank you, Engineer, for being here. We recognize your continued support for the NCI Kenya, and we'll continue to work very closely with you. And it's my request that after your remarks, you do invite the Cabinet Secretary. Thank you, Engineer.
Thank you very much, Chair. Cabinet Secretary, Ministry of Health, who is my boss, seated here. Excellency governors present today, the U.S. Ambassador to Kenya, development partners present, distinguished guests, ladies and gentlemen, good afternoon. I think because my CS is here, I will not make a long speech. I've just requested that I come here to invite her so that she can be able to speak with you, because when it comes to issues policy and she's around me, she will speak to them. But Cabinet Secretary just allow me to just give a remark that one, I want to start by thanking the Cancer Institute for this summit. Thank them for organizing this summit is for two purposes. The first one is that at least we've been accorded an opportunity to dialogue. And in this dialogue, we are doing it at an early, time, because we are into a new government. And therefore, this opportunity then accords us that time to be able to ask ourselves pertinent issues. Like, number one, what are those programs that we've had that are addressing issues to do with cancer? Who has been doing what in this space? What is that thinking the KK manifesto has put as the direction the government is trying to face at this particular moment? So that now together we have, recommendations from those who have been in the industry for quite some time, and therefore this group here must come with solutions that refocus that issue of early detection of cancer, the treatment and prevention. And for that, let me again repeat that. Thank you. Second one is to thank the partners, particularly those who have helped us in that space of cancer treatment and prevention. And the partners specifically that I'm referring to are those that are seated here and gave us what they have been able to do for quite some time. And for us, as we come into the ministry, we are saying, we will not go into this thing alone. We must work together. That's a policy direction, and that is a policy that has been given to us by the CS. That is what we must do. The questions that come to the front is one. We've been doing what we've been doing for quite some time. And I want to echo what Professor Nyong'o here, the governor of Kisumu, said. But what are those gaps that are currently existing? Have we as government, together with the partners, tried to identify and reinforce our policies towards them? And therefore then this is the forum in which we can be able to look into that, not only insofar as cancer is concerned, but other non-communicable diseases that are bedeviling this country. So for me, I think this is the right way forward, Waziri, and we should be able to encourage this kind of conversation and dialogue. With those very many remarks, let me request you to be upstanding as we invite our CS, Madam Susan Nakubicha, to come and address the congregation.
Asante sana, Dr. Gidinji. I almost missed this opportunity, but I prayed and worked hard. I've come straight from Dar into this room because of the importance that I put to this. So if you find that I am reading too much, it's because I was elsewhere and I need to make this statement. But wherever I was, it's tied to what we are doing here today. I've just come from Dar to make commitments on behalf of this country on matters of HIV and being able to end AIDS in children by 2030. And for those of you in this room, you may be aware that HIV and cancer, most of the times they work together. And therefore that was important, and I equally find this meeting very important. US Ambassador, the Chair, Dr. Gidinji, and board members, representatives of partners and agencies, our cancer warriors, distinguished guests, ladies and gentlemen, good afternoon. It gives me pleasure to join you today during this official opening of the National Cancer Summit 2023, and I recognize that it is the Inaugural Cancer Summit. I'm indeed pleased to note that this cancer control is being held as part of our build-up activities towards the global commemoration of the World Cancer Day that is held in February each year, thus enhancing our joint advocacy efforts towards improved cancer control. And I'm aware that on Saturday, we shall be celebrating this day in Garissa County. Ladies and gentlemen, cancer remains a public health concern in our country. It is the third leading cause of death in Kenya. In 2020, the country reported 42,000 new cases and 27,000 cancer-related deaths. The top 5 cancers are those of the breast, the cervix, the prostate, esophagus, and non-Hodgkin's lymphoma. These 5 cancers account for nearly half, that is 48% of the cancer burden in the country. Notably, 9 women die every day due to cervical cancer, while 9 in every 10 persons with esophageal cancer will succumb to the disease. Currently, majority of persons diagnosed with cancer will succumb to the disease, since approximately 70% of cases are diagnosed in advanced stages when cure is almost impossible. Cancer bears an immense cost to the nation due to the years of life lost as a result of premature deaths, lost productivity, and the long-term effects of cancer and its treatment on the quality of life of survivors. In addition, families suffer financial catastrophe as a result of the high costs associated with accessing comprehensive cancer care. Ladies and gentlemen, in recognition of the need for concerted efforts to address the rising disease burden, the Ministry of Health has put in place an elaborate legal and policy framework to guide appropriate cancer control interventions. It is against this background that the National Cancer Institute of Kenya was established under the Cancer Prevention and Control Act No. 15 of 2012, with a mandate to provide oversight and regulation of cancer prevention and control in the country. I am pleased to note that the Institute is taking lead in coordinating our joint efforts to mount an effective response to the growing cancer burden in Kenya and call upon stakeholders to support them in this noble task. The Universal Health Coverage Program has identified cancer as a priority focus area to accelerate access to care services with reduced financial burden. In this regard, we have continued to strengthen our primary healthcare services to offer affordable cancer screening and early detection services that are critical to early cancer diagnosis. Through collaborations with the county governments, we have enhanced access to cancer screening through training of primary health workers and distribution of screening equipment to health facilities across the county. Further, public funded treatment services have been enhanced through the establishment of more than 10 county chemotherapy centers, 3 regional comprehensive cancer treatment centers in Mombasa, in Garissa, and Nakuru, and the Cancer Center of Excellence at the Oncology Center at Kenyatta University Teaching and Referral Research Hospital, where cutting technologies such as molecular imaging and cybernerve treatment have been made available for all Kenyans. It is also noteworthy that our new administration, through the Kenya Kwanza Health Plan, has envisioned a chronic disease fund that will further bolster the financing for cancer intervention and stem the capital flight due to medical tourism for cancer survivors. Ladies and gentlemen, I acknowledge that despite making these great strides, opportunities for improvement remain front and center. Gaps related to responsive financing models and control of risks, human factors, adequate human resources, infrastructure, and commodities, and appropriate engagement of all stakeholders exists across the continuum of care. It is against this backdrop that in 2021, my ministry constituted a national task force to review the institutional arrangements and prevailing capacity for the delivery of affordable, responsive, and high-quality cancer care services. I am pleased to note that the report of this task force was presented in July 2022 and has been assigned to the National Cancer Institute of Kenya to oversee its implementation. This National Cancer Summit will thus provide an appropriate platform for stakeholders across all sectors to, among other discussions, deliberate the recommendations arising from the Cancer Task Force report, review the progress made over the last 10 years in addressing the cancer burden, identify areas of learning from successful strategies, and together formulate solutions for collective action. I am pleased to note that the summit has brought together more than 500 local and international stakeholders in the cancer control arena to drive conversations on how to improve our cancer control efforts. In line with the summit theme, uniting our voices and taking action, I call upon our noble partners and well-wishers to join hands with us in making the summit a resounding success. Ladies and gentlemen, as I conclude, I wish to reiterate our commitment as the Ministry of Health, working with stakeholders to deliver strategies which will not only transform the cancer response, but improve quality of life and bring prosperity to Kenya. I call upon us all to take personal initiative to educate our fellow brothers and sisters on leading healthy lifestyles and undergoing regular health checks to enable early detection. Ladies and gentlemen, that is an official speech, but allow me to say a few things, Dr. Githinji, and members of the press who are here. I want to call upon the press that what we are fighting in cancer is actually awareness. And we have no better people to do this awareness except you, the media. So you have a chance to make a difference. We may roll and ramp up all the efforts, but if wananchi at the grassroots are not informed of the importance of early screening, we shall still talk about the cost of cancer. While we as Kenyans talk about the cost of cancer, the pharmaceutical companies shall be driving their profits, and it is quite unfortunate. So as I stand here today, I want to call the partners in private, Roche, J&J, and other companies. I know your core business could be to drive profits, but please assist Kenyans. This government came into being on bottom-up approach. Sisi tunataka vitu ziende kule mashinani. I am happy, J&J, you said you're already involved in training, and I'd like to call upon you that you work with the Ministry of Health. We are soon going to launch 90,000 community health workers. That program, if it goes to those community health workers, it will be of much value in driving this cancer menace out of this country. I want to thank Governor Anyang' Nyong'o, and as he has said, that when he was the Minister of Health, he moved from a National Hospital Insurance Fund to a National Health Insurance Fund. And I want to declare here today that I shall be moving it from National Health Insurance Fund to a National Social Health Insurance Fund. That for us to drive this universal health care, we have to bring everybody on board. We have to be in the grassroots. And as they say, it is for the grassroots, by the grassroots, from the grassroots. And therefore, we have a team that is already working, and in the next few months, we are going to roll out the National Social Health Insurance Fund, which is going to leave no one behind. Every Kenyan is going to have access to healthcare. And for cancer and other chronic illnesses, we are ramping up support, and very soon we shall be calling upon partners, calling upon philanthropists, that we now do a major fundraising, put our funds together to be able to tackle cancer and other chronic illnesses in this country. Ladies and gentlemen, my target is by July 1st, we should have rolled out this social insurance fund. so that Kenyans can access healthcare. The President promised, and for me, is to deliver on what he promised. Therefore, I call upon partners, please support me in this space in ensuring that we roll out universal health coverage together. Asanteni sana, and with those very many remarks, I declare this National Cancer Awareness Day officially open. Thank you.
Another warm round of applause for Madam CS. The National Social Health Insurance Fund is on its way. I think that's an idea whose time has come. And now, Madam CS, we have a little something for you that we would like to give you. This is the inaugural Cancer Summit. Never has there been another Cancer Summit in this country. And so for us, we want you to take a little memory with you from us. You're going to be given a little plaque by Madam Director, Mildred. So there we go, let's take a nice photo up there. Thank you very much, Madam CS. Excellent. And then we also want you to remember that, you know, we also launched the National Cancer Report, survey report. And so please take a few copies from us. It's also available to the delegates online. It will be available today. Thank you very much, Madam CS. And you know, we have to capture this moment together. So as Madam CS is ushered down, I'm going to request that we stand and the photographers will come on stage and we'll take a photo, a huge group photo with Madam CS. So please let's stand. Then, yes, we'll take her, we'll stand down here. Yes, you guys can come here. So there's that one. This is for everybody. Yes. So, yes, exactly. So, Madam CS, you'll be ushered down here. So you will stand, and then the photographer is possible to get all your beautiful smiles. Sorry. Alright, please look at the camera. Make sure your eyes are staring at a lens somewhere, alright? We are trying as much as possible to get as many people as possible. This is the Inaugural Cancer Summit 2023, and Madam CS came, and we must record it in history. Thank you very much to our team of media. Madam CS, thank you very much. Please take our felicitations to the ministry as well. You're going to be ushered out by our board chair, Dr. Ndenji Ketahi. We're accompanied by our PS, Engineer Toom, and the board. We're going to, as the rest of us take our seats, and our dignitaries take their leave, and the dignitaries will go out and take a photo up, led by Dr. Kevenji. And let's just ensure that her table is cleared up. Thank you, Madam CS. Thank you for your commitments. We really appreciate. The rest of us can take our seats as Madam goes, takes her leave to her. And that session stands between us and lunch. And so we're going to have our session on culture and cancer, and our session chair is Dr. Salim Hussein from the Ministry of Health. Dr. Salim, are you in the building? Okay, there you are, Dr. Salim. So Dr. Salim is going to take us through the next session, and he will introduce the moderator and the panelists, and then after Dr. Salim,